The presence of which of the following antibodies is most likely responsible for this patient's condition? A 45-year-old woman presents to the dermatologist with painful, flaccid blisters and erosions on her skin and oral mucosa. The blisters are easily ruptured with light pressure, and skin biopsy reveals acantholysis in the epidermis. The presence of which of the following antibodies is most likely responsible for this patient's condition? This is called pemphigus vulgaris,
Good.
because of also just like easily ruptured and oral mucosa. And I believe that is against anti-desmoglein 3. Um, yes, I will go with that.
Good. Perfect. You worked that beautifully, right? So pemphigus vulgaris, right? Um, you get acantholysis, you get rubbing of the skin is, these blisters are very they slough off very easily, right? And so
Mhm.
which is different than tense bullae, right? And so your best answer is going to be anti-desmoglein 3. What is the other one that you have to learn it against?
Bolus pemphigoid.
Okay, and then what is that going to be?
That would be anti-hemidesmosomes.
Good, good.
Okay. Which of the following heart valves is most likely to be affected in this patient? Aortic, mitral, pulmonary, tricuspid, or bicuspid. A 32-year-old woman with a history of IV drug use presents to the emergency department with fever, malaise, and new onset heart murmur. On examination, she has a splinter hemorrhages in her nail beds and also nodes in her fingertips. Blood cultures are positive for Staph aureus. Okay, I don't think any of the diagnosis to answer this question. This one is though infective endocarditis. Those are splinter hemorrhages and also nodes are both symptoms of infective endocarditis, and Staph aureus, I think, is one of the main options here. The biggest thing for me in this is that she has had a history of intravenous drug abuse,
Okay,
and I always think about it as like if you do, you have to try my drug, and so I would do tricuspid valve because of intravenous drug abuse.
bingo. Good, perfect. That's a great way to remember for sure.